Hello everyone, welcome to our YouTube channel Logic Medico. Today's interesting topic is Serratus Anterior. So what is this Serratus Anterior? Why it's called so? We'll see everything. Serratus means like this serrated, like a sawtooth. Anterior means it's present in the anterior part of the body wall. It's present in the chest area or the pectoral region. It is one of the muscle of the pectoral region. So serratus means sawtooth like, anterior means anterior chest wall. This is a muscle in the anterior chest wall, to be more specific, pectoral region. So we have 12 ribs. Everybody knows that we have 12 ribs. So what happens? Serratus anterior takes origin from the lateral outer surface of the lateral aspect of the upper 8 ribs. This is the clavicular area. What I drew just now is clavicle. This is the sternal area. This is the sternum. Okay. So this is sternum. Okay. So fine. So this is the rib number 1 and this is the rib number 8. You can just draw like this in the exam. And then the origin of this muscle is from 8 digitations. 8 digit like things. Therefore it's called like that actually. Like this will be there. Say for example this is 1 and this is 8. Due to lack of space I have written like this. But you can write 8 things like this in the exam. So from there it goes deep to the scapula to get attached to the medial border of the scapula. So medial border of the scapula is get attached to the anterior surface. The upper 2 digits, that is the first and second digits, goes to the superior angle. The lower 4 digits goes to the inferior angle. And the middle 2 digits goes to the intermediate part. It's very simple. All that you have to remember is serratus anterior is a sawtooth shaped muscle present in pectoral region. Therefore the name. What is the origin? Outer surface of upper 8 ribs. Why upper 8 ribs? Though we have 12 ribs. Because scapula is present over there. Yeah, it's present in the upper part. That is why. Okay. Okay guys. So the first upper 8 ribs, it takes origin outer surface of the lateral aspect of first upper 8 ribs. The first 2 digitations, it takes origin like a digit. The first 2 digitations goes to the insertion of all these serratus anterior to the medial border and ventral surface. Why again ventral surface? Because the muscle is from anterior plane, so it has to go to the ventral surface. So that is an insertion. If you want to be more specific, the upper 2 digitations goes to the same ventral border, medial border, ventral aspect. Upper 2 digitations to the superior angle, lower 4 digitations to the inferior angle. The intermediate 2 digitations goes to the third and fourth goes to the intermediate border. So the nerve supply of this is one nerve which goes like this long in the thorax. It's called the long thoracic nerve. Long thoracic nerve, it goes in the mid-axillary line. So this long thoracic nerve directly arises from the root of the brachial plexus. It is C5, C6 and C7. That is called long thoracic nerve or the nerve to serratus anterior. The action of this muscle, if this muscle contracts, the scapula will move forward, and that is called as protraction of scapula. The scapula is moving forward, na? That is called as protraction of scapula. It moves across the thoracic cage. So the action is protraction of scapula. So it keeps the scapula in place, that is onto the thoracic wall. What happens if there is a damage? See, I am showing you the back of the patient. This is the back of the patient. Say this is the spines of the patient. This is the scapula. Okay, normally scapula is not that prominent from behind. But if the medial border becomes unduly more prominent, and that condition is called winging of scapula. It's called as winging of scapula. When does the winging of scapula happen? The winging of scapula happens when there is a damage to long thoracic nerve, paralysis of serratus anterior. So when the serratus anterior is paralyzed, the medial border comes out of the thoracic cage, appears like a chicken wing or anything like that, similar to that. It's called winging of scapula. So that is the importance of knowing serratus anterior. It mainly helps in pushing movement. For example, you're going to some McDonald's or anything like that. You're pushing the door. So whenever you're pushing the door, kindly remember this. Also, the serratus anterior helps in this movement of the scapula. This very few students will know this. The scapula will be like this, now it will move like this. That is rotation of scapula in such a way the glenoidal cavity will face upwards like this. This helps in overhead abduction. So when overhead abduction happens, you will be helping yourself in combing your hairs or ringing a bell. So therefore the long thoracic nerve is also called as nerve of bell, B-E-L-L, long thoracic nerve, or the nerve to serratus anterior is also called as nerve of bell. There is other name for that. So serratus anterior, in addition to helping in protraction of scapula, it helps in rotation of scapula in such a way glenoidal cavity faces upwards, so that helping in overhead abduction. Therefore the nerve to serratus anterior is also called nerve to bell. Thank you for watching and learning from our channel. Kindly consider subscribing to our channel and don't forget to press the bell icon to get the latest notification of the videos which we upload. Thank you once again.